Dopamine will make seeing new possibilities easier. It makes reframing easier. It makes mindfulness easier. And it makes embracing challenges easier. So all the key skills we talk about in like a golden hour all come in at that moment of the rebound. Once you've embraced the pain, kind of get ready for the gain and start looking forward to it.
Before we get started, if you enjoy these episodes, you might want to check out more at optimwork.com. Our website offers unique content, tools, and exercises to help you thrive at work and beyond. We have an in-depth masterclass covering our entire theory of growth, daily recommendations for personalized advice, and a platform to help groups and organizations learn and practice optimal work together. You can get a free trial at optimwork.com. Now let's start the episode. Hey, this is Sharif here with another episode of the Optimal Work Podcast, joined by Dr. Kevin Majeres. Kevin, good to be back here with you again.
Hey, Sharif, great to be back.
Yeah, Kevin. Well, I thought we could close off our series on Dynorphins here, third episode, exploring, I guess we talked about how Dynorphins are important for every type of growth, every area of growth. And maybe the example that still stands out to me is like cold plunge and sauna and this feeling of being totally uncomfortable and I got to get out of here. So I thought maybe it would be helpful to go through a bunch of examples of all these different areas and all these different ways that dynorphins can enter the picture and how they show up in different areas of growth. So
that sounds great.
Okay.
Yeah.
You okay with that? Okay.
Yeah, let's do it.
Okay. Maybe we could start with someone who thinks of themselves as, now I don't want to use the term perfectionist, but that's maybe the word that stands out, and people describe themselves that way, although we know that these things are not like fixed traits, but they're, maybe habits that we can overcome. So this is someone who might spend a lot of time on, say, an important email, just reworking it and reworking it and reworking it. So what is the area of growth here? How do dynorphins fit into this picture?
Yeah, so in the big picture, we always want to look at the two elements of there's something that has to be accepted, and then there's a kind of growth that we commit ourselves to. And that's the fundamental basis of cognitive behavioral therapy practice today, particularly as acceptance and commitment therapy. So it's just this idea that there's always a price you pay for the growth, and that is what you have to accept in order to be allowed to engage the challenge and get the growth. So I think this, like in this case with perfectionism, it can of course vary, but you could imagine that they're afraid of being judged. Let's just leave it at that. There's some pain that comes with them feeling like someone will see their work and judge them. And we could spend a lot of time thinking about all the different ways they could be judged or the thoughts they would have. But dynorphins do not attach to thoughts. Dynorphins do not attach to situations. They attach to feelings, actually. That's the fundamental thing that gets linked to dynorphins. So there's really a feeling that you have if you think that you didn't do a good job on something and you're being judged. And that feeling, chances are, the more you try to avoid it, the more sensitized you are to it, and the more it crops up everywhere. So you end up feeling judged. So this person, if they're struggling with sending an email, probably didn't start with sending an email. It probably started in something else. And then eventually it gets even to an email is hard to send. That's the classic way a vicious cycle works. A pain is avoided, you become more sensitized to it, and then you're not engaging the challenge so it can bring out your growth. And then you end up getting more and more sensitized. So here, there is something to be welcomed. So I would want this person to try to not send a perfect email. Like, what would it be like to send an email with a deliberate grammatical error typo?
I would never do that, Kevin. I'm sorry, I can't do that.
No, but, or at least doing it fast enough that they wouldn't have time to double check or triple check. So that they could set a timer. So what you're trying to do is get them to embrace the pain. Now, if you're not sensitized to this, you can probably go on double checking your emails. But if you're like spending 2 hours on an email, then this is now a pain to be embraced and welcomed. And then once you fully embrace the pain, if you can change how you're relating to it so that you can welcome it and savor it, and then even try to like aim for love and service in the task that brings on that pain. Try to make the email have the best, try to make it real loving and of great service. You would then be able to get a boost, this kind of the dopamine rebound that would help you to actually do your best email. And it wouldn't take as long. But the ticket is the pain.
Yeah. So, okay. Yeah. I think a lot of times I'll have to feel like I have to reread an email if, as every time I make a change. It's like every time I make a change, I have to reread the whole thing. This also happens when I'm programming, that, every time you make a change, you're worried that you introduce maybe a bug, and then you have to retest every single thing.
Yeah.
And then you make a little change, you got to retest everything. So, what do I do about that?
Yeah. So there can be, if it's too much, if you can tell that, okay, this is kind of taken on a life of its own, then you want to see that if you're getting too sensitized to the errors and to the idea that you'll be publicly making a mistake, that sensitization works like a magnifying glass for all negativity, and it's going to seem worse. This is the fascinating thing about dynorphins. We can go to more examples, but the way dynorphins work is they are magnifying lenses for experience. And if you're on the wrong side of them, meaning you're unwilling to experience them, then all you see is magnified negativity. And you will overestimate how terrible it would be to have a mistake. Chances are it was something that would become known, and then you'd fix it. And it's good to be able to make changes without over agonizing about it. There's a right level. So there's an optimal level of care and concern here. But on the flip side is, once you've embraced the pain willingly, now the whole dynorphin effect is like a magnification for the good. What's the skill you want to practice? What's the love and service you want to bring into this? All of that then gets magnified on the other side. And that's what we try to get people to. You have to get to that flip side of the magnifying lens.
Yeah. Well, let's talk about how to do that in the case of procrastination. And so I guess, procrastination is putting off something important that might be due tomorrow, putting off maybe for tomorrow, or even just you can procrastinate for an hour or two. So let's suppose that, I have a somewhat daunting task, like filing my tax returns, or something that's going to be painful, boring, whatever, which is coming up now. And I guess sometimes I just say, well, I need to distract myself with something totally different. Sometimes I can convince myself that, this would be actually a really good time to do this other thing that I've been wanting to do, or this other, and it feels good to like check something off my to-do list, even though it didn't have to be done right then. So that's still procrastinating, I think.
Exactly. And so any relief you get through procrastination is a setback. Relief will make you more sensitized to the pain of starting daunting tasks in the future. So when dynorphins go high, if you get relief, now you have sensitized yourself even more to whatever that thing is that caused the dynorphins to go high in the first place. So very different is the experience of learning to look forward to the pain of starting a daunting task. And the more you try welcoming that pain and savoring it, putting your finger on it, like what actually is that pain like? You'll see that the more eagerly you try to find it, the more you try to chase the dynorphins, in fact, the faster you get to the dopamine rebound. And now you feel like getting started on the task and breaking down the first step into smaller parts and then chugging away at it. So it can be a wonderful discovery for people, if they're habitual procrastinators, to try to see like, what would it be like to take a number of things you've been procrastinating and just try to do this as an experiment. Sometimes it helps for people to do a little bit of mindfulness where they settle their attention into the feeling of the breath in the chest, and then use that as the way of opening up and welcoming the pain that they get when they think of starting the daunting task. So but the more you can feel it and welcome it, the more then you flip it around. And now it's actually a boost. And you get even more dopamine. To the extent that you were procrastinating because you were avoiding the pain, you can get the same bounce from it.
Love it. Hey, Kevin. So actually, I was just, it reminds me of a conversation I recently had where I was talking with someone, a college student, who struggles to keep the right schedule, going to bed, waking up. I think that's one of the biggest challenges for college students is like getting to bed at the right time. And they kind of know they should. So it seems like he procrastinates going to bed. And one thing we kind of landed on was like, well, there's this process of going to bed that's maybe a little bit too daunting, which sounds kind of ridiculous. So it's okay, just break it down start with just breaking it down into 2 steps. So first I'm going to go brush my teeth and then I'm going to go from there to bed. So it's like, okay, can you go brush your teeth at X time, 10 minutes before your bedtime? Yes. Okay, then do that. And then you're on your way. So now, at the end of what you were saying with the dopamine rebound, would you want a dopamine rebound right before you're going to go to bed? So if there's like this dynorphin rush, I can't put off what I'm doing, I can't put away what I'm doing and go to bed. So then you embrace that and then you get a dopamine rebound right before you're going to bed. Is that what you want? Before we continue, a brief message. If you're benefiting from these discussions, please take a moment to hit like and subscribe. Doing so helps us to reach more people. So you're not just learning, you're also helping others to discover a path of growth and flourishing. Thanks for your support.
Yeah, I don't think that in that case it would be so aversive, but this is also what happens if people struggle with insomnia. So when people with insomnia have high dynorphins attached to the being unable to fall asleep. But that's really unfortunate because dynorphins do in fact wake you up. So if not falling asleep right away causes dynorphins to be released and dynorphins wake you up, that's a trap. So the best treatment is to learn to be willing to feel that pain. So, and you try to willingly be awake. The dopamine rebound, I think, is not like adrenaline, which is going to like make your heart race. It's not going to necessarily interfere with sleep at all. What it's going to do is it's going to help you practice the behaviors that follow the welcoming of the dynorphins. So the ideal thing is you teach people to have a kind of benign neglect for being awake in bed. You teach people to basically know that if their eyes are closed and they're not working, it's about 80% the benefit of sleep. You can help people learn how to practice parking their attention in someplace neutral, like playfully labeling any thoughts that come into their mind with just a couple words at most. Like, there's a thought about that. There's a thought about that. So playfully label occasionally and like just notice things. And then they have basically the same benefit of falling asleep. If people are totally willing to suffer the insomnia and treat it as not, if they're not bothered by it, then it doesn't happen. Basically, dynorphins are the measure of how bothered you are by something. So the more something bothers you, you might not be able to control that first thing, like not sleeping, but you can control the second part, which is how much it bothers you. It turns out how much it bothers you is entirely under voluntary control by willingly welcoming the pain. So, and then what you're learning is that only takes a second. And then you're going to learn how to do that better and better. And then gradually, you'll see that without the dynorphins keeping you awake, you go back to sleep or you can fall asleep more easily. Now, the person who is, you can think of procrastinating bedtime is a little bit, it's like the opposite of delayed gratification. It's delayed mortification. And so going to bed would be mortifying. Dynorphins are what makes something mortifying. It's the essence of it. So to lovingly do that, to do that with a motive of wanting to grow, to have some motive of love you can put into it that makes it worthwhile. If you're well rested, who can you better serve tomorrow? What would you do? How could you put love into this as a sacrifice? The sacrifice might be the fear of missing out on things, the fear of being somehow unincluded with what their friends are doing, which is very common. So that fear so we have to actually help people to address the pain very directly. And then we find that our ability to help them is times 10. Because if you can get the right pain in focus, you can help people a lot. Now, and it's just way more effective at helping people. So that's why it's so crucial.
Yeah, I think for me, you know why I stay up too late, and okay, but actually, yeah, for me, it's like, well, there's this thing that I could do, and I should just do it right now. I can't. If I push it off till tomorrow, I might not be able to do it. So I should just do it right now. So that's part of it. And then, can you explain, Kevin, why before you go to sleep, it's like you don't want to go to sleep at all, but then it's like you'd rather be up than asleep, but then when the alarm goes off, you'd rather be asleep than up. It's like the opposite. Like, what's going on there, you know?
Well, that might just be, that might be determined by your NAD levels, that you're young. So you have a lot more energy. Yeah. And so think of it as an investment in the next day, that energy will be there waiting for you. And if you were to think of like tomorrow, what would be the highest use I could put that energy to? Like, what would be the true maximum? Well, I'm sure that would be enhanced by getting more sleep. As long as you're not getting more than 9 hours.
Okay. All right. Fine. I'll do it. The other thing was, the next one. So, you've, I think, talked about before, you call it maybe the minimizer, like you have a big argument or some big issue, and then this person says, whatever, it's not that big a deal. Which I thought, I don't see what's so bad about that. That seems like a good quality, someone who's willing to, but you're saying there's something underlying that, which is like an inability to like deal with conflict in some way.
Yeah. Now, if we are minimizing other people doing wrong to us, I see no downside to that. Like I really do believe that charity most often is making excuses for people and trying to be just understanding of them. So, and that's something I do try to live by, that if there's an opportunity to make an excuse for someone, great. If there's an opportunity to even better, to try to be compassionate and to validate whatever their pain is, even better. So even when you feel the pain. But minimizers tend to be, it's a lot like denial. So, and many times they minimize the impact that their behavior has on others. Or that there's just the importance of like, well, so I get a B in this class, that's not a big deal. So, how is that going to, well, what does I'm not saying that you have to be overly concerned about grades, but neither would I want someone to be uncommitted to doing their best academically. Like if that's your job right now because you're a student, then you really want to be committed to doing the best in it that you can. And if you have a spouse who's upset with you because you always do something that really bothers them, well, then minimizing becomes just a way of not taking responsibility. And maybe so you could think there's a particular pain that person would feel if they felt that they had to somehow take full responsibility for some situation, particularly if it made someone else uncomfortable or pained. So then that would be what you'd want to be curious about helping them to respond to in a better way. This is interesting because you might think that minimizing your own pain would be somehow strengthening, like it would increase your pain tolerance. We know that's not true. At least I think there's really good research that any validation we get that our pain is real and that it actually does exist and that it makes sense in some way, that kind of validation again and again has been proven to increase people's pain tolerance. And you rate things half as painful when you validate the pain. So there's really there's never been an experiment that I've ever heard of where minimizing pain of any kind ends up having you somehow like desensitized to pain. Minimizing is a form of avoidance, and that sensitizes you. But then it blocks your willingness to let others see the pain, or even yourself to acknowledge the pain. That's not a healthy situation. So compassion begins on the inside, and it means with validating the pain that's there. So sometimes if we can just put a name on what's bothering us, even naming an emotion, like, okay, what's the emotion I'm feeling right now? So I'm really bothered by something, and sometimes it happens where I've heard people say they get hot and bothered. I think that idea of being hot and bothered is right, because like you can feel like sometimes you feel like your blood, like your temperature goes up, and your face might get flushed and you're really bothered by something. It helps to then put your finger out, instead of denying that something's bothering you, to really own up, like, what is it that's bothering me? And yes, okay, it makes sense, because these emotional reactions always make sense. It might not be the whole picture, but they make sense. So if you can be understanding towards it, and then like more warmly approach it, that's already willingness. So, and then once you willingly feel it, then you can actually engage the real challenges.
Yeah. Yeah. And it seems like the opposite extreme is kind of, you could think of like playing the victim, like complaining. So would you see that as the opposite extreme of the minimizer? And then you kind of have to chart a middle course in between those two, right?
Yeah. Yeah, that's right. And so in some ways, they both may be avoiding feelings of shame or guilt in their own way. One puts it on others and the other just denies its existence. But in the long run, both of those strategies are ways of being unwilling of experiencing ordinary emotions. And the emotions themselves are understandable and they can be welcomed. And the more willing you are to feel it, then the less those triggers will bring out your worst.
Yeah. I'll give you a softball here, Kevin. I mean, the minimizer and the playing the victim is, I mean, when I think of work, I think of, I think of writing a computer program or, completing some technical project. How relevant are these to work in your estimation, like a professional context, playing the victim? Is that something that's maybe more relational and kind of outside of work, or do you see this as really impacting, people's work environments? And
I think it's pretty fundamental to, the deep avoidance to shame that we all experience. I think everyone has to find a way of overcoming the avoidance of shame. Yeah, and we did a series on humility, but what humility does is it removes the dynorphins from shame, to put it that way, so that when shame comes, you can accept that it's there, and then you can still make sure that situation brings out your best. I see playing the victim as a way of trying to like make sure that one doesn't take responsibility or doesn't bear any blame. So they blame others usually. So I'm not sure I've ever labeled anyone a victim. Like, oh, they're playing victim right now. And so I don't think that would be...
That feels invalidating.
Yeah, exactly. That would be totally invalidating.
I shouldn't have brought it up. I'm sorry.
So, but I think that the reality is all of us can experience times when we're annoyed at others. And it can be very helpful when others let us down or annoy us or do something that we feel maybe betrayed, maybe whatever it is, that it's good for us to be thinking first of, rather than focusing on the bad that they did, to simply be validating, like on the inside, that yes, this hurt. And it probably makes sense that it would hurt. Probably given our whole history, this kind of thing could be a kind of sensitive area for us. But it is not going to be something, I mean, in order for them treating us like that, to bring out our best, most mature, most reasonable response is going to involve not magnifying the badness of it. And when we're caught in these struggles with the pain we're unwilling to experience, it really magnifies negativity. And so everyone else's intentions get magnified as negative. And it's like, oh, they were probably just trying to hurt me when they said that. Or they're probably just trying. And it's very easy to fall into suspicion and attributing to people all these negative intentions. When you're experiencing that directed at other people, that negative magnifying of other people's defects, that's where you especially have to then say, okay, this is really about me and the pain that I'm experiencing. Let me see if I can open up and be more welcoming. Can I be more warm on the inside towards it? Can I be more compassionate with it and understanding? And just let that be the first movement. As you do that, it'll be easier and easier then to get beyond that negative magnification and to start to think, how could I really improve this relationship? I always want us to use that dopamine rebound for growth. And so once you've accepted the pain, find a way to commit to the gain. Find a way that this can bring out your best response. That way, the whole situation now has been reframed. That what's hard has been embraced, but then the capacity for the good it can bring out in us has been amplified.
And that's the formula of acceptance. You said acceptance and commitment, which is acceptance and commitment therapy.
And that's how all growth works.
Right. So, okay, last one, because we're kind of out of time here, and I want to throw in a little bit of a theoretical question here. So if we're considering, say, someone who works too much, a workaholic, and I recently heard that, the things that you love the most, if you wake up in the middle of the night and you, whatever you think about is kind of like what's most on your mind is what you love the most. And I realize sometimes I wake up at like 2 a.m. and check my work email, which is like not really useful.
Yep.
So this would be the workaholic idea.
Mm-hmm.
And I guess just one kind of thought here is it seems like a lot of times the behaviors the avoidance behaviors are ways of avoiding the dynorphins, in addition to what we do when the dynorphins come to escape them. But if the habit is so deep that it's like an avoidance behavior, so it's like it doesn't even trigger the dynorphins because we're just kind of precluding that possibility, then how do we identify that this is an area we need to work in? Because I could see if it's about, escaping dynorphins that we frequently experience, then it would be more possible to identify this. Like, well, I felt the dynorphins and then I kind of escaped and I gave in. But if it's a case of avoidance, how do we know that this is something, okay, this is my area of growth right now?
Yeah. Well, okay, just one thing to mention about what you think of in the middle of the night. So what comes up is most related to simply what is salient for you. And anything that you love or fear could be salient. And you can't really tell which is it in the moment. All you know is that it has salience. And so your default attention brought it forward. Maybe it related to a dream. Maybe it's just something on your mind. So there's a skill you can have of directing your thoughts towards higher things in those moments. And that's something that you can look forward to practicing in those moments. And if you look forward to practicing it, then it'll be easier to practice it. So, and then because it'll become more salient to do that kind of practice. But it's true that you do sometimes have people where, let's say that workaholism is a way of avoiding all intimacy or vulnerability or loneliness or whatever it might be. Now, it could be it could just be that there could be lots of it doesn't have to be related to some deep-seated pain. But if you're talking about a person who has spends no time with family and is working all day long until let's say he goes to bed, and then wakes up and repeats it. Well, do you think there's a lot of life that's missing there? So ordinarily, if you're working well, you're able to finish your work in most cases, before dinner, and then with dinner spent with family or friends, or at least on the way to that in some way, and then. I would say that it's important that people actually not work at all after dinner. So I've had a rule that I can go 10 years never checking a computer after dinner. So it's just not, I think I had to do it once for something. I don't remember what it was. But that might have broken my 10-year streak. But I have always had this thing of just do not use email, do not It happened once like 20 years ago that I got an email from a patient or something that was very concerning. And I happened to look at it right before I went to bed. I was like, oh, and that one painful experience made me like, I'm never checking email in the evening. But so the first thing would be that if you can tell that there's rigidity, the loss of flexibility is usually the sign that people are avoiding something. And then if they were to do the opposite of whatever the rigid thing is, they would actually experience the pain they're avoiding. So, so if you're working with them as a mentor, you would want to help them to see, let's come up with another schedule. Let's come up with something more flexible. And then even in advance, they'll feel the pain. So, and if you can help them to follow that pain down, you can sometimes it's very remarkable. They can really get flooded with the feeling of it. But that's the moment then to practice being compassionate with it. Try to be understanding with the pain's existence, validate its existence, try to be warm with it, embrace it, savor it. And with that, then they can start to see there's another possibility that opens up. And the dopamine will make seeing new possibilities easier. It makes reframing easier. It makes mindfulness easier. And it makes embracing challenges easier. So all the key skills we talk about in like a golden hour all come in at that moment of the rebound. So like, I would just say people so once you've embraced the pain, kind of get ready for the gain and start looking forward to it.
I love it. Kevin, okay, we're out of time here.
All right, Sharif, thanks so much for the questions.
All right, thank you. And we'll be back next week. Thanks for tuning in to today's episode. If you enjoyed our conversation and you're looking for more in-depth guidance, check out optimwork.com, our unique platform that delivers content, tools, and exercises to help you thrive at work and beyond.